Hey, welcome back to the channel. I'm Dr. Sophia. And if you're watching this right now, I want you to stop whatever else you're doing for just a moment, because what I'm about to share with you today could genuinely change your life. And I don't say that lightly. I've been in medicine and health education for a long time, and I've seen a lot of things, but the research and the real patient stories behind what I'm going to talk about today genuinely surprised even me. So if you've been dealing with that burning, that tingling, that strange numbness in your hands or your feet, if you've been waking up at night because your legs feel like they're on fire, or your fingers feel like they've fallen completely asleep, if you've been told that nerve damage is just something you have to live with, especially after the age of 60, I need you to hear this because the story that science is now telling us is very, very different from what most people have been led to believe. So let's get into it. And I promise you, stick with me all the way to the end of this video because the most important part, the specific details about dosage, about timing, about what to combine this with, that's all coming and you're going to want every single piece of it. Now, I want to start by painting a picture that I think a lot of you are going to recognize. You're somewhere around 60, maybe 65, maybe even 70 years old. You've lived a full, active life. You've worked hard, you've taken care of your family, and then one day you notice something strange. Maybe it starts in your toes, this little buzzing sensation like a low-level electrical hum that never quite goes away. Or maybe it's your hands. You're trying to button a shirt and your fingers just don't cooperate the way they used to. You drop things more often. You feel unsteady when you walk. The floor doesn't feel quite right under your feet. You go to your doctor, they run some tests, and the word that comes back is neuropathy, peripheral neuropathy. And in a lot of cases, people are told, well, this is just part of aging. We can manage the symptoms, but the damage is done. And that word damage, it sits in your chest like a stone, doesn't it? But here's what I want you to understand right from the start of this conversation. That narrative, the one that says nerve damage is permanent and progressive and you just have to accept it, that narrative is being seriously challenged by modern neuroscience. Nerves are not as static as we once believed. They have the capacity to regenerate. They have the capacity to heal. And the rate at which they heal or fail to heal is very often tied directly to what's happening at the nutritional and cellular level in your body. And after 60, one particular deficiency becomes so common, so widespread, and so devastating to nerve health that when it's corrected, the results can be nothing short of remarkable. And that deficiency is in a vitamin that most of you have probably heard of, but almost none of you have been told the full story about. I'm talking about vitamin B12. And before you think to yourself, oh, I've heard about B12, I know about B12, I want you to stay with me because I guarantee you there are layers to this story that your doctor has almost certainly never explained to you. The relationship between B12, nerve regeneration, and aging is one of the most important and most underappreciated stories in modern nutritional science. And the 14-day timeline in the title of this video, that's not a marketing exaggeration. That's based on real biological mechanisms that I'm going to walk you through today. So let's start with the basics, and then we're going to go deep. Vitamin B12 is a water-soluble vitamin, and your body cannot make it on its own. You have to get it from your diet or from supplementation. For most of your younger years, if you were eating meat, fish, eggs, dairy, your body was absorbing enough B12 to keep things running smoothly. But here's where it gets complicated. After 60, as we age, our stomach produces less of something called intrinsic factor. Now, intrinsic factor is a protein that your stomach makes specifically to help your body absorb B12 from the food you eat. Without enough intrinsic factor, you can eat all the steak and salmon and eggs you want, and your body still won't be pulling adequate B12 out of that food. This is called atrophic gastritis-related malabsorption, and studies suggest that somewhere between 30 and 40% of people over the age of 60 are experiencing this to some degree, 30 to 40%. That's not a small number. That's a massive portion of the older population walking around with depleted B12 levels and having absolutely no idea. Now, why does this matter so profoundly for nerve health? Here's where the biology gets fascinating. Your nerves are surrounded by a protective sheath called myelin. Think of myelin the way you'd think about the rubber insulation surrounding an electrical wire. If the insulation is intact, the electrical signal travels fast, clean, and efficiently from your brain all the way down to your fingertips and toes. But if that insulation starts to break down, the signal gets scattered. It gets distorted. It gets lost along the way. And that's exactly what you experience as tingling, numbness, burning, weakness, and loss of coordination. B12 is absolutely critical, non-negotiable for the synthesis and maintenance of that myelin sheath. Without adequate B12, myelin starts to degrade. And once it starts degrading, the damage compounds over time because your body doesn't have the raw materials it needs to repair what's breaking down. But here's the piece that changes everything. When you restore B12 levels to optimal ranges, particularly through specific forms of supplementation that I'm going to talk about in just a moment, the myelin sheath can rebuild, the nerve fibers can regenerate. And this process, while it does take time in its later stages, often begins showing real, measurable, subjectively felt improvement. Within 2 to 4 weeks, within 14 days in many cases, the burning starts to ease, the tingling begins to quiet down. The numbness starts to lift. People describe it as though someone is slowly turning the volume down on a noise that they'd gotten so used to, they'd forgotten what silence felt like. Now, I want to talk to you about something that most people don't understand when they go out and buy a B12 supplement. Because here's the thing, not all B12 is created equal. When you walk into a drugstore and you see B12 supplements on the shelf, the vast majority of them contain a form of B12 called cyanocobalamin. And while cyanocobalamin is technically B12, it is the least bioavailable form, meaning your body has to do a significant amount of work to convert it into the active forms that it can actually use. And after 60, when your metabolism is already less efficient and your gut health may already be compromised, asking your body to do extra conversion work is the last thing you want to do. The forms of B12 that you want to be looking for are methylcobalamin and adenosylcobalamin. These are the bioactive forms. These are the forms that your body can use directly without having to go through multiple conversion steps. Methylcobalamin in particular has been shown in clinical research to have a specific and profound affinity for nerve tissue. It crosses the blood-brain barrier more effectively. It supports the synthesis of myelin more directly. It reduces oxidative damage to nerve cells. And when given in adequate doses, it has been shown to actually promote the regrowth of damaged nerve fibers. There are studies published in peer-reviewed journals showing that methylcobalamin supplementation at therapeutic doses promoted nerve regeneration and significantly reduced neuropathic symptoms in patients with diabetic peripheral neuropathy within just a few weeks of starting. These are not fringe studies. This is real documented reproducible science. Now let's talk about dosage, because this is where a lot of people go wrong even when they do choose the right form. The standard recommended daily allowance for B12 is around 2.4 micrograms per day, and that amount is sufficient to prevent the most severe deficiency symptoms in a healthy young adult with normal absorption. But if you are over 60, if you already have measurable neurological symptoms, if you have any degree of absorption impairment, that amount is almost certainly not enough to move the needle therapeutically. The doses used in clinical studies that showed nerve regeneration benefits were significantly higher. We're often talking about doses in the range of 1,000 to 500 micrograms per day, and in some clinical settings, even higher when given by injection. This might sound like a lot compared to the standard recommendation, and that's because it is. But B12 is water-soluble, meaning your body excretes what it doesn't use. So toxicity at even these elevated doses is extraordinarily rare. However, I do want to be very clear here. Before you start any new supplementation protocol, especially at therapeutic doses, you should talk to your doctor, get your B12 levels tested, and work with a healthcare provider who understands the nuances of B12 therapy. I say this not to put a disclaimer on the conversation, but because your specific situation matters and the right approach for you might be slightly different from the general framework I'm describing. Now, I want to circle back to something I said earlier because I want to make sure it really lands. After 60, the issue isn't just about whether you're getting B12 in your diet. The issue is absorption, and this is why so many older adults are genuinely deficient even when they think they're eating a nutritious diet. Beyond intrinsic factor decline, there's another major factor that dramatically impairs B12 absorption, and it's sitting in the medicine cabinets of millions of older Americans right now. It's called metformin, and it's one of the most commonly prescribed medications for type 2 diabetes. Long-term metformin use is strongly associated with B12 depletion. And given that type 2 diabetes is itself one of the leading causes of peripheral neuropathy, you have this devastating irony where the medication being used to manage the condition that causes nerve damage is simultaneously depleting the vitamin that your nerves need most to heal. If you are on metformin and you are experiencing any neurological symptoms, this is a conversation you need to have with your doctor today. Not next week, today. Proton pump inhibitors are another category. These are medications like omeprazole and pantoprazole that reduce stomach acid, and they're commonly prescribed for acid reflux and GERD. They're also available over the counter. And long-term use of these medications significantly reduces your stomach's ability to extract B12 from food. If you've been on a proton pump inhibitor for more than a year, your B12 status deserves serious attention. Let me tell you about something that happened in a clinical case that really illustrates how powerful this can be when you get it right. I want to be careful here because I'm not going to give you specific patient details that would compromise anyone's privacy. But I can tell you that the pattern I've seen, and that's been documented in research, is consistent and clear. Patients presenting with significant peripheral neuropathy symptoms, burning feet, numbness in the hands, balance problems, fatigue, even mild cognitive changes. Patients who have been told their condition is just age-related deterioration when tested reveal severely depleted B12 levels. When that deficiency is corrected with high-doses bioavailable methylcobalamin, sometimes through sublingual tablets, sometimes through injections, sometimes through a combination. The improvement that happens within the first 2 weeks is often described by patients as almost miraculous. They're sleeping through the night for the first time in months because the burning has calmed down. They're picking up their coffee cup without dropping it. They're walking without that unsettling feeling of not quite trusting the ground beneath them. These are real human life-changing improvements. And they're happening because the body finally has what it needs to do, what it was always capable of doing, healing itself. Now, I want to talk about something that makes this even more powerful. Because B12 doesn't work in isolation. It works within a network of nutrients. And when you support that network, you amplify the results dramatically. The most important co-player in this network is folate, specifically the active form of folate, which is called methylfolate or 5-methyl tetrahydrofolate. B12 and folate work together in a process called the methylation cycle. This is a fundamental biochemical process that affects DNA repair, neurotransmitter production, inflammation control, and yes, myelin synthesis. When you're deficient in B12, the entire methylation cycle gets disrupted. And when you support it with both B12 and active folate together, the repair process is significantly more robust. If you're looking at supplementation, look for products that pair methylcobalamin with methylfolate, because these two work synergistically in a way that neither achieves as fully on its own. Vitamin B6, specifically the active form called pyroxyl 5-phosphate or P5P, is another important player in nerve health. B6 is involved in the synthesis of neurotransmitters including serotonin and dopamine, and it plays a role in myelin formation as well. However, and this is a critically important, B6 toxicity is actually a real concern at high doses unlike B12. Taking very high doses of B6 for extended periods can actually cause neuropathy not treated. So with B6 more is absolutely not better. You want it in the range of around 10 to 25 milligrams per day as part of a B-complex formula, not megadosed on its own. Alpha-lipoic acid is another compound that has earned serious scientific credibility in the context of nerve health, and I'd be doing you a disservice if I didn't mention it in this conversation. Alpha-lipoic acid is a powerful antioxidant, and it has a unique property that most antioxidants don't have. It's both fat-soluble and water-soluble, meaning it can access and protect virtually every compartment of your cells, including the mitochondria inside nerve cells. Research in diabetic neuropathy has shown that alpha-lipoic acid supplementation can reduce pain, tingling, and numbness significantly, and it appears to work particularly well when combined with B vitamin therapy. The typical dose used in research is between 600 and 1,200 mg per day, and the alpha-lipoic acid form is more bioavailable than the synthetic S form that's often found in cheaper supplements. Magnesium is something else I want to touch on because it's so fundamentally involved in nerve function and yet so commonly deficient in older adults. Magnesium is involved in over 300 enzymatic reactions in the body, many of which directly influence nervous system function. It helps regulate the activity of NMDA receptors, which are involved in pain signaling. It supports mitochondrial function in nerve cells. It helps modulate the inflammatory response that contributes to nerve damage. And it's depleted by many common medications, by stress, by poor sleep, and by the same dietary insufficiencies that contribute to B12 depletion. If you're addressing nerve health without addressing your magnesium status, you're potentially leaving a significant piece of the puzzle on the table. Now, I want to talk about something that goes beyond supplementation because the most powerful approach to reversing nerve damage is always a comprehensive one. Diet matters enormously here. The foods that are richest in natural B12 include beef liver, which is probably the single richest food source of B12 on the planet, clams, sardines, salmon, beef, eggs, and dairy products. If you're eating these foods regularly, you're getting good dietary exposure to B12. But remember what I said about absorption. If your intrinsic factor production is compromised, dietary intake alone may not be enough, which is why sublingual or injectable forms of methylcobalamin can be so effective. They bypass the gut absorption pathway entirely and deliver B12 directly into the bloodstream. Anti-inflammatory eating is another critical piece of this. Nerve damage is not just a deficiency issue, it's also driven and sustained by chronic inflammation. The standard American diet, which is high in processed foods, refined sugar, industrial seed oils, and ultra-processed carbohydrates, creates a pro-inflammatory environment throughout the body that actively works against nerve repair, shifting toward a diet that's rich in colorful vegetables, omega-3 fatty acids from sources like salmon and sardines and walnuts and flaxseed, high-quality protein, and healthy fats from things like olive oil and avocado. This kind of dietary shift creates the biochemical environment in which nerve repair can actually take place most effectively. Food is not just fuel. Food is literally the raw material from which your body builds everything, including the myelin sheets around your nerves. Blood sugar management is something I have to address as well, because chronically elevated blood sugar is one of the most destructive forces for nerve tissue in the human body. Advanced glycation endoducts, or AGEs, form when sugar molecules bind to proteins and fats in your body, and they cause widespread damage to blood vessels and nerves. This is why diabetes is so strongly linked to peripheral neuropathy. Even if you don't have a diabetes diagnosis, if you're regularly experiencing blood sugar spikes and crashes, if you're carrying extra weight, particularly around the midsection, if you're sedentary, your blood sugar regulation may be contributing to nerve damage in ways that undermine everything else you're doing for your health. Reducing refined carbohydrates, prioritizing fiber, eating protein with every meal, getting regular movement. These things all support healthier blood sugar patterns, which in turn supports healthier nerves. Movement itself is something I want to highlight specifically because it's so often overlooked in conversations about nerve health. Exercise increases blood flow to peripheral nerves. It stimulates the production of something called nerve growth factor, which is literally a molecule that your body makes to support the growth, maintenance, and survival of nerve cells. You don't need to be running marathons. Gentle daily walking, even 20 to 30 minutes, has been shown to improve neuropathy symptoms over time. Yoga and Tai Chi are particularly beneficial because they combine gentle movement with balance training, which retrains the nervous system's proprioceptive pathways. Those pathways that tell you where your body is in space. If you've been avoiding activity because of pain or unsteadiness, I understand completely, but starting gently, even with just 10 minutes of slow walking, is worth every step. Let me also take a moment to talk about sleep because this is the window during which your body does the vast majority of its repair and regeneration work. Your nervous system is no exception. During deep sleep, your brain essentially flushes out metabolic waste products through a system called the glymphatic system. This process is critical for neurological health. Chronic sleep deprivation or poor quality sleep impairs this process and contributes to neurological decline. If you're waking up multiple times a night because of burning or tingling in your feet and legs, addressing those neuropathy symptoms directly through the nutritional strategies we've discussed can actually improve your sleep quality, which then creates a positive feedback loop. Better sleep means better repair, which means improved neuropathy symptoms, which means better sleep. Getting that cycle moving in the right direction can be a genuine turning point. I also want to touch on something that doesn't get talked about enough in the context of nerve health, and that's stress. Chronic psychological stress elevates cortisol levels, and chronically elevated cortisol depletes B vitamins, impairs sleep, promotes inflammation, and constricts blood vessels, including the tiny capillaries that supply oxygen and nutrients to peripheral nerves. Stress management isn't a soft optional add-on to a nerve health protocol. It's a core component, whether that means meditation, deep breathing exercises, time in nature, social connection, prayer, whatever works for you and brings your nervous system into a calmer state. Make it a non-negotiable part of your daily life. Now, I know some of you watching this are thinking, this all sounds great, but how do I know if B12 deficiency is actually my problem? And that's a completely fair question. The answer is to get tested. Ask your doctor to run a serum B12 test. This is a standard blood test, widely available and not expensive. Now, here's an important nuance. The standard lab range for B12 typically flags levels below about 200 pogs per milliliter as deficient. But many functional medicine practitioners and neurologists who specialize in this area believe that neurological symptoms can occur at levels that standard labs would consider normal, anywhere from 200 to 400. Some experts argue that optimal levels for neurological health are closer to 500 to 1,000 picograms per milliliter. If you're coming back with a result that your doctor says is fine, but you're still experiencing symptoms, it may be worth asking specifically about where your number falls and whether a trial of B12 supplementation at higher doses would be worth exploring. There's also a test called methylmalonic acid, or MMA, and another called homocyan. Both of these are more sensitive markers of functional B12 status than the serum B12 level alone. When B12 is deficient at the cellular level, MMA levels rise and homocyan levels rise. Elevated homocyan in particular is associated with both neurological damage and cardiovascular risk. Having these tests run alongside a standard serum B12 gives you a much more complete picture of what's actually happening with your B12 status at the cellular level. So let me bring this all together for you, because I want you to leave this video with absolute clarity about what the key takeaways are. If you're over 60 and you're experiencing any form of neuropathy symptoms, tingling, numbness, burning, weakness, balance problems, the very first thing you should do is get your B12 levels tested, including MMA and homocyan if possible. If deficiency is confirmed or even suspected, work with your doctor to start a high-doses methylcobalamin protocol. Support that protocol with active folate with a reasonable dose of P5P and consider adding alpha-lipoic acid and magnesium. Shift your diet toward anti-inflammatory, nutrient-dense whole foods. Manage your blood sugar. Move your body gently and consistently. Prioritize your sleep and manage your stress because every one of these factors either supports or undermines your body's capacity to do what it is fundamentally designed to do, which is heal. The 14-day timeline is real. It's not guaranteed for everyone at the same rate because the degree of deficiency, the duration of the damage, and individual biology all play a role. Some people feel significant relief within days, others take longer, but the direction of change when you get this right is almost always positive. And that positive direction, that first sign that things are getting better rather than worse, that is the moment that changes everything for people. Because once you feel that, once you experience that first real reduction in the burning, that first morning where you wake up and your feet don't immediately hurt, you know that healing is possible and that knowledge is powerful beyond measure. I am Dr. Sophia, and my mission on this channel is exactly this: to give you the information that can make a real difference in your life in the language of real human beings, without the jargon, without the dismissiveness, without the assumption that because you're over 60, you should just accept decline as inevitable. You should not accept that your body has remarkable capacity for healing at every age. And your job, our job together, is to give it every possible advantage. If this video helped you, if something I said today clicked for you or gave you a new direction to explore, please hit that like button because it genuinely helps more people find this content, and it tells me that I should keep making videos like this one. Subscribe if you haven't already because I put out new content every week covering the most important topics in health and longevity after 60. And leave me a comment below. Tell me whether you've dealt with neuropathy symptoms. Tell me what's worked for you and what hasn't. I read every single comment, and your experience matters not just to me, but to everyone else in this community who's on the same journey. And if there's someone in your life, a parent, a sibling, a friend, who's struggling with nerve pain or has been told their nerve damage is just something they have to live with, please share this video with them, because sometimes the most important information is the information we share with the people we love. I'll see you in the next one. Take care of yourselves.